Joining me now is Dr. Anthony Fauci, Director of the National Institute of Allergy and Infectious Diseases and Chief Medical Advisor to the President. Dr. Fauci, thank you for being here with us tonight.
My pleasure. Good to be with you.
Thank you. Now, first up, CDC data shows cases are rising, especially here in the D.C. area. A lot of these local governments are saying they need more help from the federal government. They need more vaccines. So what is the federal government's plan of attack here?
Well, as you probably know, that yesterday the announcement was made that there will be a coordinator at the level of the White House, Dr. Bob Fenton, Mr. Bob Fenton, who is a FEMA administrator who has been very successful in the implementation of vaccines in an equitable manner for COVID. He's going to be the coordinator from the White House. The deputy coordinator will be Dimitri Daskalakis, who is a very well-respected physician, infectious disease expert who used to be in the Department of Health in the city of New York, who is now with the CDC, who has very extensive experience and credibility, particularly with the gay community, in infectious diseases, to make sure that an all-of-government response really goes smoothly in getting the vaccines in an expeditious manner to those who need it, including those of us here in Washington, D.C. So I would expect that addition to the all-of-government response that the president made yesterday is going to have an important impact on getting things done in an expeditious manner.
Yeah, on the same note, Dr. Fauci, we know this is not COVID-19. Monkeypox spreads differently. We already have a vaccine, but what are some lessons learned from COVID that are informing the federal government's response to monkeypox? Have we learned anything from this?
Yeah, I think it's important, first of all, to engage the community, which we are doing at multiple levels. I certainly, from the standpoint of the cities that are hit hardest, namely Washington, D.C. and Chicago and Los Angeles and New York City, is to make sure that we engage the community in making sure the implementation of the interventions that we have are expeditiously done. We have an unusual situation here. People often contrast and compare what went on in the early years of HIV, where we did not have a pathogen in the early years, 1981. It wasn't until 1983 and 1984 that HIV was discovered to be the cause of a syndrome that had been devastating mostly the gay community for 3 years up to then. We didn't have therapies, and we certainly didn't have a vaccine. Right now with monkeypox, we have diagnostics. We know exactly what the organism is. It's monkeypox. It's a virus that we've dealt with for decades, mostly in Central and Western Sub-Saharan Africa. We have a vaccine and we have therapies that we developed originally against smallpox, since this virus very much is in the category of smallpox, although it is much less severe. So the real challenge now is to expeditiously get those interventions to the people who need them, not only those who clearly know that they have been exposed because a person that they've had a sexual relationship with is someone with known monkeypox, but also those who generally are at risk, which is more of a pre-exposure prophylaxis with vaccines. So a lot of vaccines have now been deployed, many, many more than were just a few weeks ago. By the end of the week, we hope to get over 700,000 more vaccines distributed throughout the United States. And I believe that those of us here in Washington will have enough to be able to distribute to the people who need them.
And Dr. Fauci, how would you rate the federal government's response so far? Again, this is a virus that we're familiar with. There's already a vaccine, but it's taken so long to get that out to the people who need it.
Well, I think you have to put things in context when you say it was so long to get it out. If you look at what was asked for by the cities, which was mostly in a post-exposure prophylaxis, that the vaccines were gotten to them at that level. What we didn't have right off the bat, which likely we should have, would have been enough mobilizable vaccine to get it to everybody who needs it, purely because they're at risk, not because they have a documented exposure. So I think it's really much too early to give any rating of what the response is. I think we should need to wait to see how things go now that the vaccines have been more actively and aggressively deployed, and then give a rating as to see how things were done. I think it's too premature to do that right now.
Okay, what would you like to see happen from here moving forward?
I'd like to see everyone who would benefit from a vaccine and a pre-exposure prophylaxis have that vaccine readily available to them. I'd like to see the drug, the TPOXX, that is a treatment for monkeypox, be easily available to the people who need it through their physicians and healthcare providers, and that the paperwork and the bureaucratic obstacles that may have existed get completely removed so that it is relatively easy for someone to get treated rather than have a lot of paperwork. And I think already this is being addressed, and things are much easier now than they were, let's say, a few weeks ago.
So it sounds like you're confident that we can get this contained relatively quickly.
I hope so. I mean, it's something that I do myself. I could tell you how confident I am in it. So the only thing I could say is I believe that the people who are involved in getting this done know the challenge, and I believe they'll get it done.
All right, Dr. Fauci, we know you also played a role in the government's ongoing fight against HIV and AIDS. And, we're seeing some parallels here right now, a virus mostly impacting men who have sex with other men with the potential to spread much further. We know that. So how can the government fight any stigma associated with monkeypox, and why is that so important?
Well, it's very important because whenever you focus your attention on a demographic group, in this case, men who have sex with men, there's always the danger that there will be an element of stigma that is directed at the group that you're trying to engage and trying to help. So you have to walk a fine balance from alerting the community of the danger and providing them with the resources to counter that danger without pointing a finger and stigmatizing them. Because without a doubt, we know from very good experience, dating all the way back 40 plus years with HIV, that the true enemy of public health is stigmatization of the people who are afflicted.
Yeah. We're told children are especially vulnerable to monkeypox. Are you concerned about that heading into the fall with schools reopening?
I think we have to take it seriously. I don't think it's a cause of panicking by any means now, but we absolutely must pay attention, close attention to that possibility, and make sure we do everything we can to prevent the spillover from a population that is 98% involved that goes outside that population. We need to take care of that group. At the same time, we prevent it from further spreading.
And what should companies do if someone in the workplace gets monkeypox? Is it a similar response to what we've seen with COVID-19?
Well, I think one has to first report it to a physician and get that person isolated, and then find out what kind of contact that person may have had. If they were not close personal skin-to-skin contact, then I don't think there would be an issue there. But what would likely happen is that if it's a documented case, you would vaccinate the people who were around that person in any way that they may have had personal contact with them.
Okay. And what is the efficacy of the Genus vaccine? We know a lot of people are getting that vaccine. So how effective is it? How long does it take to sort of build up that immunity?
Well, Genus is a 2-dose vaccine. It gives some immunity after one dose. By 28 days, you get good immunity, but you want to get boosted, you get durable immunity. Immunity of a vaccine usually starts 7 to 10 days after you get it. It can peak around 4 weeks or so thereafter. The reason for the 2 doses is to create a degree of durability so that the response goes higher to begin with and lasts longer. So that's why you do that. Now, the first part of your question was what? I just answered the number of doses, but what was the first part of the question?
The efficacy of this Genus vaccine.
Thank you. Well, the efficacy has been proven in an animal rule model because we didn't have monkeypox or smallpox at the time that the tests were done for the Genus vaccine. So you had to do it on an animal model, and it showed to be quite effective in the animal model. The FDA has a rule called the animal rule that when you show something is safe in the human and is effective in an animal model or two animal models, then you can give approval for that intervention. And thus far, that has the proof. So what we're doing right now is we're designing a trial. We've already started a trial in the Democratic Republic of the Congo, a randomized placebo-controlled trial to determine efficacy. And we will be starting a trial here in the United States to show efficacy here with the virus we're dealing with.
All right, so if you already have monkeypox, should you still get the vaccine?
Yeah, I don't believe you need a vaccine if
Okay.
you have monkeypox. The same with smallpox. Once you've gotten infected with it, the fact is you don't need it. However, that depends on how long after you've got it. If you've gotten monkeypox and recovered from monkeypox, then it is unlikely that a vaccine will give you a lot more protection. However, if you've been exposed and have monkeypox, there's a window of several days where the vaccine would be beneficial to you. So you've got to make sure you distinguish if you got monkeypox now, completely recovered, and then a month later, should you get it, versus I got monkeypox now, I have the early exposure, can I get a vaccine within several days of the exposure? That's not really getting monkeypox. That's getting exposed to monkeypox. So you want to make sure people don't get confused.
Right.
If you get exposed to monkeypox, you have a window of several days where you can get protected against it, even though you've been exposed to it.
Yeah, that's really good to know. And, you know, Dr. Fauci, we've heard from some people saying this should be declared a public health emergency nationally. Do you think so?
Again, I'm going to leave that up to the Secretary of Health and Human Services who'll make that determination.
Okay. Anything else you want to add?
No, we're good.
We covered a lot. All right, Dr. Fauci, really appreciate you. Thank you so much for everything you do.
My pleasure. Good to be with you.